my name is Myra Carnejo and I am going to be talking about a birth control method called Implanon. What is Implanon? Implanon is a thin, flexible plastic rod inserted under the skin and the upper arm. It works at preventing pregnancy for up to 3 years by releasing ethnogestrel, which comes from a hormone called progestin. This hormone thickens women's cervical mucus, thus making it more difficult for sperm to reach the eggs. In addition, it keeps the eggs from leaving the ovaries, consequently not allowing the sperm to get to the egg. As mentioned before, Implanon is inserted in the upper arm in a matter of minutes. Before inserting the implant, the individual is injected with a painkiller in the location that the implant will be placed. Next, the introducer is placed under the skin very carefully. As soon as it is in the proper location, it is unlocked and pulled out, leaving the rod under the skin. After the procedure is done, it is important that you feel the implant to make sure it was placed correctly. Once it is felt by the individual and the healthcare provider, then they can proceed to bandage the area up. To visualize the size of the rod that was left behind, picture a match as they are around the same size. The rod can be left up to 3 years before needing to be replaced, but it can also be removed as soon as the individual no longer wants to be on birth control. To remove the implant, the healthcare provider will again inject the patient with the painkiller and then make a small cut to simply pull out the rod. As one can imagine, this form of birth control is not like others and needs to be done by a healthcare provider. However, once it is inserted, there is nothing else to be done. A great factor when deciding which birth control method to go with is looking at its effectiveness. In a year, out of the women who chose Implanon, less than 1 out of 100 women will become pregnant. There are certain medicines that can reduce its effectiveness. If you need to take any form of medication and are on the Implanon, consult with your doctor to assure it will not reduce the effectiveness. Another influencing factor when picking birth control is the cost. For the Implanon, there are 2 procedures involved, the insertion and the removal. For the insertion, the cost can range from $0 to $800. The removal is less, ranging from $0 to $300. Although the cost may seem high, there are many programs that adjust the cost depending on the individual's income. Also, more health insurances cover the Implanon. Nevertheless, there are some disadvantages associated with the Implanon. Women claim that the most common side effect are changes to their menstrual cycle, especially in the first 6 to 12 months. Some of these changes included having longer and heavier periods or increased spotting in between periods. Something some women may view as a positive thing is that most women have less frequent periods as well as lighter. Nevertheless, changes in the menstrual cycle have caused 1 out of 10 women to remove the Implanon. Some of the less common side effects include development of cysts, acne, nausea, headaches, weight gain, changes in sex drive, mood swings, back pain, and sore breasts. Another disadvantage is that the Implanon does not protect against HIV or STIs. Therefore, to protect against infections, one should wear protective barriers such as condoms. However, there are some benefits as well from choosing the Implanon as a method of birth control. For starters, it is highly effective, and once it is in there, there is nothing else that needs to be done. No daily pill, and it protects for up to 3 years. It is also discreet. Although it can be felt, it is not easily seen by others. Some benefits for certain women are that it can be used while breastfeeding, and also this method is progestin only. Therefore, the women who cannot take estrogen can use this method. Ultimately, the Implanon is a good method of birth control, and those who do not wish to have a baby in the near future.
Created using Powtoon.